Hello and welcome to Medical Dialogues. I'm Roshni. Let's look at today's top headlines. New NMC guidelines recommend yoga department in every medical colleges with one male and one female instructor. The UGMEB of National Medical Commission has suggested that every medical college may start a yoga department. Further, the commission has mentioned that such a department of yoga needs to have a minimum of one male and one female yoga instructor to train the students and faculty in yoga. While the trainers shall be engaged by the concerned medical college, NMC UG board further mentioned that consultation with the Ayush Ministry or its guidelines could also be utilized. These recommendations by NMC UG Medical Education Board have been included in the recently notified guidelines for undergraduate courses and establishment of new medical institutions, starting of new medical courses, increase of seats for existing courses, and assessment and rating regulations 2023. Every inpatient fall cannot be considered result of malpractice unless caused by medical negligence. Commission absolves Indraprastha Apollo Hospital. Holding that every fall cannot be considered a result of malpractice unless it was caused by medical negligence, the Delhi State Consumer Disputes Redressal Commission has adjunked a complaint against Indraprastha Apollo Hospital, Sarita Vihar, alleging medical negligence in handling a patient of metastatic hilar cholangiocarcinoma with dislodged PTBD who fell from the hospital bed and eventually died. Justice Sangeeta Dhingra Sehgal, Pinky and J.P. Agarwal clarified that to constitute a fall injury in a medical facility, the fall must have been the result of a medical provider failure in providing an acceptable level of care. In the instance, care medical record suggested that the patient was immediately attended to after the fall and all necessary actions were taken, but if the patient did not survive, the blame cannot be passed on to the hospital and the medical staff provided all possible treatments within their means and capacity, the court further said. NMC prohibits doctors from participating in events sponsored by pharmaceutical companies. The NMC has introduced new regulations that aim to prevent doctors' involvement in seminars, workshops, or conferences sponsored directly or indirectly by pharmaceutical companies or the allied health sector. Violating these regulations could result in a suspension of the doctor's license for up to 3 months. These regulations, found in Section 35 of the new Professional Conduct Rules, also prohibited doctors and their families from receiving consultancy fees or honorariums from pharmaceutical companies, medical device companies, or corporate hospitals. This move is intended to address the issue of doctors receiving payments through various contracts for lectures, workshops, and other services. Previously, there was a ban on doctors receiving gifts, travel facilities, or hospitality from pharmaceutical companies. However, this rule was diluted over time to allow gifts up to a certain value and to permit doctors to attend events as faculty rather than delegates. The new regulations seek to close such loopholes and ensure that doctors receive payments only as employers' salaries or benefits from relevant organizations. While these regulations represent an improvement over previous standards, some aspects are considered into a single paragraph, leaving certain details vague. That's all for today. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.